Guys, good morning. Um, that day again this time of year where we look at the new insurance options and make choices for ourselves and our families in what is a continually fairly complicated environment of trying to figure out what's the best choice to go, and much of it outside of our control, given what's happening from a regulatory perspective and the way that our government's intervening with this system. That being said, we shared with you at the quarterly that we were looking at a lot of options, and we've been working hand in hand with our broker, and as you will find out, also with other insurance companies other than United Healthcare, as a function of what they came back with in terms of their renewal rates, A, and B, also their coverage options. And so we kind of got things tidied down in terms of the plans that we're going to offer really yesterday. And we've got some additional numbers to crunch. I think at the end of the day, you guys will be, it's not a huge increase, not a substantial increase. We're going to be able to keep it on par for last year. We're actually not going to release the numbers till probably tomorrow or the next day in terms of the costs for each plan. So we've got another chance to look at it before we release it, make sure we get it right before we send it out to you guys. So today's going to be focused on the different plans, their benefits, so you can get a picture of what those are. And then over the next couple of days, you will be choosing based on the costs that go along with each of those plans. And I think the enrollment actually is going to happen in ADP, if I heard correctly. So we're even going to change the way that we enroll. So it'll be in the ADP system, which you guys have become familiar with, as opposed to the way that we've done it in the past. So, yeah, we'll answer any questions on the back side of this, and thanks for your patience. Thanks.
Good morning, everyone. I have a sad admission. Every year I bring you stress balls. I have a few, but the Amazon, failed and sent me like stress balls that were like this big. And I couldn't give them to you because they were like not of the quality that I would give. But Tyler from Humana came to the rescue, and he has some Humana stress balls. Now, I don't think I have enough for everybody, but I have toothbrushes and Band-Aids and stress balls, and I will make it up to you. But my daughter got married on Sunday, so my life has been, it's been a wee bit crazy if you've all ever planned a wedding. And so we survived on Sunday, and we were very blessed. But I just wanted to let you know that normally I have smiley faces and fun stuff. And this year, Humana came to the rescue. But I promise I'll be back before the end of the year, and I will bring you a fun stress ball. And we just have to blame the Zon for making the picture look this big, and they were really this big. So I don't know how you can call that a stress ball, But anyway, this is Michelle Sutter. I've been here now for many, many years. But today's going to be a little bit different than in the past. You see, I don't have a PowerPoint. And what I wanted to do this year is just introduce you to Humana. We've been with United Healthcare for many years, and it worked. But unfortunately, we've had some recent changes in network, and some of you have had challenges working with the local hospital. So I was charged with going to market and seeing who would work with us that would give us better network options within the hospital. Just even one simple thing is United was not in network with the emergency room there. So we were seeing some individuals getting bills from the physicians that treated them in the emergency room for $1,800, $1,500. And that never would be what we wanted. And Humana has contracted with the emergency room, so it will be whatever copay is listed on the plan that you select, that's what you pay. Or if you're on a high deductible plan, that's what you pay. I tried also not to change up the plans too much. I've worked hard to educate everyone over the last few years on the plans and how they work, and trying not to change them every year to confuse you. So the plans this year, all but one, are pretty much apples to apples of what you had before. So if you were on the high deductible plan before, the plan with Humana is the same coinsurance and the same deductible. It's just a different carrier. If you were on that 2000 buy-up plan, so the highest cost plan that had deductible and copays, Same thing. I did a $2,000 plan with copays. The one plan that they do a little bit different is, if you recall, last year we introduced the Primary Advantage plan that had copays on the top 5 services, and then everything applied to deductible. And we had a large increase in enrollment for that plan. Well, Humana doesn't have a plan that's an apples to apples, but I actually think you'll like it better, and it's actually the plan my family's on. So Humana is the insurance carrier for the employees that work for World Insurance. So I know Humana very well. I use it. The plan that Tyler's going to go over is a plan that I have for my family, and a little bit different than Primary Advantage. Primary Advantage only had the copays on the 5 top services. They're what they call the Simplicity plan, to make it simple, has copay for everything. So it tells you what your copay is for an MRI. So instead of going to deductible, you ever go in and you're not really sure what the bill's going to be because it applies to deductible, and I don't know how much that's going to be. Now, before you step into the doctor's office, hospital, or a provider for an MRI or CT scan, you know exactly what you're paying going in. And so you'll have copays listed out for everything: pharmacy, doctors, specialists. So right now, Primary Advantage, if you went to a specialist, that did apply to deductible. Here, it has a copay. Now, a few of the copays are a little bit higher because you have a 0 deductible. But when we looked at the comparison side by side, the urgent care went up a little bit and the emergency room went up a little bit. But the emergency room went up like about $100. But compared to paying $1,600 extra because they weren't in network with United, it was a definite plus in my mind to have that trade-off of knowing what you're paying when you go in. This afternoon, you're at the I Know About Insurance meeting, so the quiz will be at 11 because you all came to the I Know About Insurance meeting. But if you need to know more, I'm here again at 2 to do a Benefits 101. Dental and vision will stay with Humana, no changes. So we'll keep that plan. Unum Voluntary Life stays in place with no changes. So the only change we made this year was adding Humana to the Humana offering, so now it'll be medical, dental, and vision. This year, as Bob mentioned, you will be enrolling through ADP. So as in the past, you'll get an open enrollment guide, but it's going to look a little bit different this year. We'll send it out to you electronically. On there, it'll list out all the plans for you that we reviewed today. And we're really just going to focus on the Simplicity plan because the other plans are the same. So I would trust if you have the high deductible plan by this point, you figured out how that plan has worked. And because a majority of the individuals were on that Primary Advantage, we're going to focus on what we think you might select, which is a Simplicity plan. And that actually was a summary that we handed out. In addition, they brought a membership kit for everybody that goes into some of the other programs, and Tyler will go over these with you. When we look at 2020, it's all about, and even in my own company, is our 2020 vision. What are we looking to have and make clarity of going into the new year, and what do we need to focus on? And one of those is wellness. Humana, in my opinion, and I've been licensed since 1987. I've been doing this a long time, but have worked with Humana here in Georgia for the last 15 years. Has the strongest wellness program. Again, I'm on it with my family, where they actually have, if you engage and do the wellness program, it helps future renewals as a collective because we're a healthier group. But they also have a way for you to earn what they call mall bucks. So when you do certain steps, and we're going to be doing a lot of promotions in the next year, we're going to have different wellness events, we'll have someone come in and do biometric. How many of you might do a Fitbit or some type of tracker, Apple Watch? You earn points for that. So all of your wellness gives you mall bucks, which in turn you can get Amazon gift cards, you can get Fitbits, I've seen you can get movie tickets. There's a whole host of things that you individually are rewarded with for participating in the wellness program. And then our goal is to have everyone engaged. The more we have engaged, it does help us next year at renewal because they feel, and they've done their studies, that engaged employees in wellness make better patients, better consumers, and then that helps us next year at renewal to try and keep our renewal increase down. So you'll see we'll have a special biometric event coming up next year because we're they start January 1st. So next year we'll have a flu shot clinic where you can have your flu shot here. That'll be next year because they're as of January 1st. So we're real excited about the wellness program. This year, different from in the past, you'll enroll in ADP. So we'll create a self-enrollment guide with the plans, with the directions. You always have myself and my team. Snow is here over at the table if you have direct questions for her. We were jokingly saying, because Snow is like 5 feet too, and we were jokingly, as some snowflakes flew, that we have 5 feet of snow in Gainesville today, and she's over. But she told me that joke because her brothers used to say it, so I'm allowed to repeat it because I didn't create it. So, but she's awesome. And now Snow's in the office all week, 40 hours a week and more, to help all of you whenever you have a question. I do travel. I'm actually on the road every day this week for enrollment meetings as we're in the midst of fourth quarter. But I'm always available by email if you have specific questions and want to go over anything. I'm going to let Tyler come up and talk about Humana, then I'll come back up and talk about a few of the savings tips that I typically share, and we'll wrap it up, and then we'll fight over the few stress balls that I have, and then we have toothbrushes and Band-Aids too. So, but Tyler Moore has been with Humana for as long as I remember. I've been 15 years here in Georgia. It's got to be close.
14 years.
14 years. Mm-hmm. We're about the same. Actually, what's today? November
12th.
Thursday's 15 years since I moved to Georgia and started working at World. So hard to believe. So he has his own special ear mic. So I will let him talk and present and introduce Humana, give a little background on Humana, talk about the Simplicity plan so you know how that new plan works, go over Go 365, and then I'll come back up. Thank you.
Awesome. Well, thank you for that introduction, and good morning, everybody. As Michelle said, my name is Tyler Moore. I've been with Humana for coming on 15 years next year. And you have a few things in front of you as far as information and leave behinds. We won't have time to go through everything that you have today, but the intent of that envelope that you have is for you to have a quick, easy reference to all the great things that come with you now being a Humana medical member to accompany your dental and vision coverage that you've already got with us. So the first thing that I want to review is this document that was outside of your envelope, which is the Simplicity plan that Michelle referenced as a new, different plan as compared to what you currently have. It's called the Simplicity plan for a reason, and that's because we looked at, had a number of quantitative and qualitative studies and focus groups and a lot of data and information to really understand, hey, where do people get confused and hung up with health insurance? Largely, it's two things: deductible and coinsurance. Those are the two things that commonly people are just confused about. Even people in the industry sometimes get hung up on those items. So we thought to ourselves, well, what if we could create a plan that removed those two most complex pieces of the equation? Wouldn't that be interesting? So, I don't know, 5 years ago or so, the Simplicity plan was born. And it is simple because those components are gone, and there's a co-payment for every single service, all of which track towards your maximum out-of-pocket. So once you've hit your maximum out-of-pocket, the plan, Humana, pays 100% of whatever other charges are incurred. So as Michelle alluded to, it's one of the only plans out there that you can really know what you're going to pay before you go to the doctor, rather than waiting for an explanation of benefits to come in the mail to see what was paid for, what was omitted, what was excluded, and all of that. So my goal today is to help you have a clear understanding of how this Simplicity plan works. This SBC can be a little confusing when you read it. These are the summaries of benefits and coverage that the government said we had to use these and all in the same standard format. So many people feel that it's not the most legible and easy to read document. However, I'll do my best to make sense of this for you. So the first page really hits on some of the higher cost items and showing you what your total out-of-pocket is. So for an individual, it's a $6,500 out-of-pocket, and for a family, it's 2 times that amount. The network is the same on this plan as the 3 other plans that are being offered, which is called our National Point of Service Open Access Network. I did a little search just before I came here this morning, and there's about 460 primary care physician and subspecialty primary care within 15 miles of where we're standing right now, and 3 hospitals, including Northeast Georgia Medical Center, which I know you all have had a handful of hiccups there with some provider charges and emergency room things of that nature. So it's $6,500 individual out of pocket, 2 times that for a family. Remember, every single copayment tracks towards that value, and once that $6,500 is reached, Humana pays 100% of everything. So on page 2, the next page, it reviews the kind of more commonly used items, which I would consider your primary care physician and your specialist office visits. As Michelle also alluded to, there's a trade-off when you take away a deductible and a coinsurance on a plan. Some of the copayments, as a result, tend to be a little bit higher. But again, that's the trade-off that you make to get to that $6,500 out of pocket. So you'll notice that the copayment for a primary care physician is $30, and the copayment for a specialist provider is $75. Again, all of that will track towards that maximum out of pocket. Your plans all do also have a benefit known as telemedicine or virtual visits. We partner with an organization called Doctor on Demand. Many of you may have heard of them. It's a free app for you to download in the App Store. There's some information in your envelopes around that telemedicine benefit. One of the things I would encourage you to do before you need it is once you're effective with Humana, go ahead and download that app and register. That way, when you're traveling or you're out and about and you're sick and don't feel well and don't feel like going to the doctor, and you can see a doctor right on your couch in your PJs, but sometimes it's a little bit more of a process to register when you need it. But rather, I would encourage you to register for Doctor on Demand before you actually need it. That way, when you need it, it's ready to go, and you can just connect right to a physician over your smartphone. So again, that's a PCP copay for this plan, and for all the other plans that you're being offered as well, with exception of the high deductible health plan, which would be subject to the telemedicine benefit would be deductible coinsurance to a maximum of $49 on that plan specifically, okay? Your diagnostic lab and x-ray, so if you go to the doctor and you have your diagnostic lab and x-ray work outside of your annual physical, which is covered at 100%, and you shouldn't pay anything for that. But let's just say you go in for a subsequent doctor's visit and have lab and x-ray work done. That would be subject to the office visit copayment, so whether you went to a primary care physician or a specialist provider, as long as they send that to LabCorp or Quest, which are the 2 biggest in the industry really, or perform it and bill it in the provider's office, then you would only pay that copayment for the PCP or specialist provider that you visited, okay? Now, outside of the diagnostic lab and x-ray, there's some more expensive tests that can be done, which are like MRIs, PET scans, CAT scans, and if any of you all have ever had to do any of these, you know that they're very costly, which is why I would first of all encourage you to be a consumer and shop for this, as you would anything else. That's one of the big things in our business, in the insurance world, is people so seldom treat their insurance like they do everything else that they're purchasing on a day-to-day basis. What do we do when we're going to get a new car? Well, we're going to research a whole bunch of different sites and tools and make sure that you're getting the best possible deal that you can. Well, you can now do that with health insurance as well, with all of the tools and resources and data that is out there for you to take advantage of. Think about medications, for example. GoodRx is one that many people have heard of, and there's now commercials out there for. So that's an example of another avenue, another tool or resource for you to have a comparison capability to see if you go to Kroger or CVS or Walgreens, what the cost of that medication is going to be, okay? So I encourage you to be a consumer with your health care like everything else that you tend to be within your day-to-day lives. So imaging, advanced imaging is what that's referred to, those more costlier PET scans, CAT scans, MRIs. That is a $500 copayment, which again goes towards that maximum out of pocket. And if you should find a place like an outpatient facility to get it done for $450, then that's what you'd pay. It's $450, not the $500. Any questions so far? No? Okay. On the next page, you'll find information about the formulary and the copayments with respect to each medication. So the way that the drugs are grouped with this specific formulary is based on cost of the medication. So Tier 1 would be a $10 copay, Tier 2 a $45 copay, Tier 3 a $90 copay, and Tier 4, which are often your very expensive, commonly self-injectable, shipped on dry ice, very low shelf life type of medications. Those are oftentimes extremely expensive, and coincidentally or not, those are oftentimes the ones you see commercials for on TV. People prancing through a field very happily and jolly like, Oftentimes there's lower cost alternatives to those medications. So again, with my example of being a consumer, make sure that you're checking for those generic alternatives that may be available. Every 7 years, drugs fall off patent from the manufacturer, and a different manufacturer picks up these medications and puts a different filler in, and then they charge 80% less for the medication. Oftentimes, you can achieve the very same clinical outcome with these generic alternatives. So just keep in mind and try those when they're available, because oftentimes they can help save you a great deal of money. We are our own pharmacy benefit manager. Humana is. We manage billions of dollars in medications on an annual basis. We have our own mail order pharmacy subsidiary organization as well. Humana Pharmacy is the name of it, and Humana Specialty Pharmacy is specific to our specialty medications. So the reason why I mention that is you can always, I would encourage you, and there's some information in your envelope around this as well, but signing up for mail order medications. So for any of you who have to take those maintenance medications that you're on a daily basis where, hey, a 90-day supply saves you money, right? Well, you can go to Humana Pharmacy, get the mail order benefit of that particular medication, and pay 2.5 times the copayment rather than 3 times the copayment for 90 days. And it's shipped right to your door, and it's very convenient. So I would encourage you to do that for those of you who are on maintenance medications or really any medication. It's a great convenient way to get your drugs without having to travel to the drugstore, right? Facility. So let's say you have an outpatient surgery and you go in and you're out that same day. That's going to be a $1,000 copay per visit. Again, it's going to track towards your maximum out of pocket. All these things with the higher copays are things that are deductible and coinsurance on the other plans that you've had in the past and the other plans that Humana is offering. So again, that's out of the equation on this plan. The copayments are higher, so I don't want you to get nervous about that because it comes out to a pretty similar cost when you factor in the deductible and the coinsurance that would apply on these benefits to the other plans that you'll have. Let's see here. What haven't we covered? The next page. So typically, the most expensive thing that you're going to experience is an inpatient hospital stay. With all of the other plans and the plans that you currently have, that's going to be, again, deductible and coinsurance, right? Well, with the Simplicity plan, let's say, God forbid, something horrible happens and you're admitted to the hospital for a month. All that you would be responsible for is the inpatient copay times 3. So regardless of how long you're there beyond the 3 days, you're only responsible for the 3-day copayment. So the inpatient copayment is $1,000 a day. So again, you're there for 3 weeks, you pay $3,000. That $3,000 goes towards your $6,500 out of pocket. Okay? So it's very different than the deductible coinsurance type of format, but it is very easy to understand, and it's a simple flat copayment. Now, for emergency room, sometimes people utilize their benefits maybe different than I would encourage them to, and they go to the emergency room for non-emergent situations. First off, I would never encourage you to do that unless you have just time to kill and you want to just go sit there and wait, or you'd like to pay an exponential amount more for the same services. So if that's what you want to do, then go to the emergency room. I wouldn't condone it. But if you do, and you're not admitted to the emergency room, then it's a copayment. It's a $500 copayment. Okay? If you're admitted, which is typically an inpatient stay of 18 hours or longer, that's when the inpatient copay of $1,000 would apply. If you're admitted, that $500 copay is waived. Okay? Outpatient surgery, outpatient services, like mental health, behavioral health, or substance abuse, that's a $30 copayment. Inpatient stays related to those services would be the same inpatient copay as staying at the hospital, so $1,000 a day times 3 as the maximum. And that is basically the Simplicity plan in a nutshell. Your urgent care is the only other thing that I have not touched on, which I believe is $100 on this plan. Let me confirm. 125, excuse me. So that's correct. So, there's different layers and levels of seeking care. So there's your telemedicine or virtual visits, which is a PCP copay. Then there's your primary care physician. And there's also those retail clinics out there, which are becoming much more prevalent. Think about like the Kroger Little clinics and places like that, where you can go seek care for the common cold and smaller issues. That's going to be a PCP copayment as well. So, you've got 3 or 4 different levels where you can seek care at a, $30 or $40 PCP copayment, and then the urgent care facilities, which can tend to do a bit more comprehensive medical services, that's a $125 copay, and it does go towards that maximum out of pocket again. Any burning questions? No? Okay. Well, the other piece of information that I wanted to review, or pieces, is included in your envelope here, and this is just to give you a quick overview of everything that's included in this envelope. Much of the information is specific to the Go365 wellness program that Michelle referenced a little bit earlier. So I'm excited to share this with you because I think you'll find it something worth taking part in and earning the incentives that are available for you to earn. So included in this envelope, you've got your dental and vision plan summaries, which hopefully everyone is pretty well familiar with, and I'll be around for a few minutes to help address any questions around the dental and vision should you have any. There's no changes there. This document here is probably the Go365 Bible as far as all the different ways that you can take part of engaging in the program. Many people feel like, oh gosh, a wellness program, what do I have to do? Go run a bunch of miles and do a bunch of push-ups or log my food. This is really more centered around your overall health and well-being and helping you understand the choices that you make can have an impact on your overall well-being. And chances are, if you're a happy, healthy employee, when you come to work every day, you're more productive for the organization that you work for. So all of this fits into paint a really nice picture. And Go365, we've had this program for a number of years now, and I can't tell you, we've got literally millions of member months of data to validate and with actuarial science behind it to tell us that this works. We know that if you do the things in this program, people's lives begin to improve from a health perspective, and you begin to be more conscious of the decisions that you're making. I always like to think about, look at 30, 40 years ago, what were the serving sizes that were available when you would go have breakfast, lunch, or dinner? Vastly smaller than they are now. Look at the supersized drinks you can get now. They're this big. So that's an example of, hey, maybe I shouldn't get the supersized me one. Maybe I should get the medium one, and maybe I'll feel better as a result. Or better yet, maybe I should eat a salad instead of, McDonald's. So all of these choices that we make, and sometimes we do it consciously, and sometimes we do it without thinking, but they do impact our well-being and how we feel and how we show up for work and the people we care about on a daily basis. So all this program is really rewarding you for making those healthy lifestyle choices. My wife, for example, is a runner, and she loves running in half marathons and is going to do her first full marathon. She's completed the turkey jog, which is, I guess, the triple race where there's 3 different races in Atlanta. So it's really important to her. And for her to get points associated with her running, all she has to do is take a picture of herself at the finish line of the race that she's done, a 5K, a half marathon, or whatever. So many of the things that we do, this program is going to give you points for. And those points you can redeem for items that are important for you within the Go365 mall that Michelle referenced earlier. From fitness equipment to movie tickets and music downloads to saving up for a bigger item, or even Target or Lowe's or Amazon gift cards. So, there's just an abundance of different ways you can use the points that you earn, and there's an app that's available for you to also take advantage of in a really easy, simple way, which is also included in your folder there. But one of the first steps to the program is really taking the health assessment or connecting a fitness device like a Fitbit or a Garmin or a Polar. There's about 100 different devices that will speak with our system. Once you connect it just one time, it wirelessly sends the data up. So let's say you take 10,000 steps in a day. Well, you get 10 points. Maybe you just blew it out of the water that day and took 50,000 steps. You get 50 points. So everything that you do, in a verified way, you get points for those different activities that you're doing. Taking a health assessment gets you 500 points just right off the bat. It's quick and easy and a painless, kind of fun, actually. It gives you a picture of your health and gives you what's known as your Go365 age when you're done. So this is the age that your body thinks that you are based upon the lifestyle choices and the information that you just put into the health assessment. So sometimes it It's interesting because you could be 30 years old and get a number back of 45. And sometimes it's just that simple, easy thing that makes someone realize, well, dang, I didn't realize that the choices I'm making have that bad of an impact on my overall life and well-being. And it makes people think about things a little bit differently. And that's a bit of a drastic example, but it's not surprising to see somebody with an older age than what they actually are. So that's oftentimes a goal that people have when they do take the health assessment is I want to get my Go365 age to match my actual age. There's calculators and first aid certification and CPR certification. So this isn't your run-of-the-mill wellness program that, again, is go run a bunch of miles and do a bunch of push-ups. This is centered around education and healthy living and healthy eating and preventative activities. So we all know we're supposed to be going to the doctor once a year and getting our preventative checkups, right? We don't pay anything for it. It's all paid for 100% by the carrier. So why not do that? Well, you get points for doing that. Same thing with your oral and ocular screenings. So people often say, the eyes are the window to the soul. Well, that's true from a health perspective as well. There are so many things that can be diagnosed through a regular eye exam. Macular degeneration, brain tumors, diabetes, high cholesterol, the list goes on and on and on. Same thing with your teeth and having your appropriate teeth cleanings. So you get points for all those things within this program. Again, I mentioned many of the things you're already doing on a daily basis, like going and getting your preventative checkups. So those would all be something you wouldn't have to submit any validation or proof that you did it. It just goes right through the claims system and you get your points awarded in your MyHumana or Go365 account. Let's see here. You get points just for confirming your contact information and going to the website to thumb around, because we know the more you go out there, the more you're going to learn about how to navigate it and take advantage of all the tools and resources that are available for you. One of the biggest pieces of this program is getting your biometric screening, which Michelle also alluded to. We're going to have a vendor come out to this location and conduct that biometric screening. And it's a quick, easy, painless deal, usually a finger prick and a BMI, where they weigh you, measure you, and take your blood glucose, your triglycerides, your cholesterol, and give you some of those important metrics. And you get points for doing that. And then you get points if all of your items are within a healthy range. So there's just a ton of different ways to engage in the program and take advantage of it. And it becomes fun. Little kids are playing in sports leagues, kickball leagues and football. Well, all you have to do is fill out a little form and submit the information, and you get points for your kids playing in a sports league or yourself playing in a sports league. So again, it's a fun program. There's a lot of ways to take advantage of it and engage in it. So again, included in your folders, you've got just a ton of additional information around the program. This singular document really covers a lot of it, but you've got some other supplemental documents like how to earn points and quick, easy examples of things you can do to start engaging in the program. Any questions? No? Some of the other documents in your folder here are, guiding you around, staying in network. Michelle again alluded to some of this around some of the billing examples that you all have been faced with for, going to an in-network hospital and finding out after the fact that maybe the doctor that saw you in the emergency room isn't in network. Well, that isn't a certain carrier thing. That's really an industry thing that more than likely isn't going to change until legislation really steps in and does change it. But as Michelle mentioned, the emergency room doctors for that facility are in our network, so hopefully that's not something that you experience. But this little piece just helps to refresh you on ways to take advantage of staying in network and making sure to do that whenever you can. Humana Beginnings prenatal program, EAP and work-life services are something that's included within your Humana plan. There's also a preventative services guide in your kits that just give you a reminder of all the different preventative services that are available to you at no cost for your annual checkup. The Doctor on Demand virtual visits that I referenced earlier, there's some information in there on that for you as well. Again, the cost of that is the PCP copay. MyHumana, which is your secure member page. So once you're effective with Humana, this is where you would navigate and look up doctors and medications and all the information around how to manage your plan. That's where you would do it, is in the secure MyHumana page. So it's just like anything else you go out and register for and sign up for. And then that's also where the Go365 information is as well. And there's a separate Go365 app that you can download as well for free. That's everything I've got in my envelope here. Any questions? Does the Go365 program sound exciting? Sound like something you want to take advantage of? Great. I believe Michelle has that for you. I'm not sure when she'll be passing that out or distributing it, but I know that that is something she'll have available for you. Any other questions? Well, I appreciate your time this morning. Thank you very much.
To answer your question on the side-by-side, we will be sending that out, and it'll include the side-by-side, the ADP instructions, the payroll deduction costs, and all of our contact information. Instead of giving it to you piecemeal, we wanted to give you as one document. And so as soon as they finalize all the budgetary pieces to it, because the whole thing is very complicated, that once we have that all together, then you'll get that in electronic format. And then if you have questions, if you run into any issues with ADP, we felt that last year was brand new doing the enrollment inside ADP. Now you've had a year of practice logging into ADP, and then you'll just go in to select the plan, select the dental plan, the vision plan. There's only one option there. And then on the Unum side, and if you have any questions on the voluntary life, we have handouts for that additional, is on the voluntary life with Unum, we did that last year, was guaranteed issue, which meant that no matter your medical conditions or any health issues, it would be issued without question. What's nice with the Unum offering is each year at open enrollment, you're allowed to purchase additional insurance. Say if last year you only bought at the minimum $10,000, you can go up to the guaranteed issue amount with no questions this year as well. Now say if you purchase more or you're purchasing for the first time because last year you didn't purchase any, then you just have a health questionnaire to fill out, and we'll get a report that tells us if you went over that guaranteed issue amount, and then we'll reach out to you to fill out that form. So change-wise, minimal on the health plan. The simplicity was the biggest one, but I think it's a positive change because we wanted to find a plan that made it easy for you to budget. And then the follow-up piece will be the one with the comparisons, the directions, so then you can print it out and have everything you need to make a wise decision right in front of you versus trying to find that piece of paper I gave you today, waiting for an email to come, and you have it in 3 different ways. We're going to do it all in one email and work to make it as simple as possible, or at least health insurance is never simple. And just to go on again about what Tyler talked about is the biggest thing when it comes to healthcare is asking questions. Whether you're at the pharmacy, at the doctor, going to get an MRI, I do this for my family. I'm extremely frugal. I just had to pay for a wedding, so now I have to be even more frugal because those get expensive. But I do it for myself and ask questions. And I tell stories every year that I come here. And, one from years ago for my dad is my mom would do anything for my dad when he was alive and he needed medication. So she would always fill whatever they told her and really never think about it. But this one particular time, it was $150 a month, and they're on a fixed budget with Social Security. So she just simply said to me, I know he needs this medication, but it's really expensive. And I said, well, did you ask if they had a different option? She's like, well, I didn't think there was. They told me he had to take it. And you do think that oftentimes. So I went to Rite Aid with her. I still vividly remember standing there, and I explained to the pharmacist, my parents are on a fixed budget. My mom's trying to do the best she can for my dad. He had Parkinson's and, unfortunately, many other ailments. Is there an alternative to the medication he's on? And she's like, the pharmacist is like, yeah, there is. It's liquid instead of a pill form, and it doesn't taste that good. Well, with Parkinson's, your taste isn't the best anyway, so... And I'm like, well, what's the price difference? He's like, it's $5 a month. I go, well, for $145 a month, my dad can suck it up once a day and drink the liquid, and he didn't care. He was fine with it, and granted, I might not like to drink it, but for $145 a month, so it's just that simple question that she never thought to ask. But even people, and we've talked about this before, when you would think that an MRI would be the same price at every single facility, and it's not. Even prescriptions, you know, Tyler mentioned GoodRx, is if you want an education, and some people watch streaming services, and if you do, you don't get barraged with drug commercials. But if you watch like ABC, NBC, the traditional, every night by the 11 o'clock, you can diagnose yourself with about 5 conditions, and your legs don't work, you're depressed, and you can't sleep, that you can go get prescriptions for all of those pretty easily nowadays if you ask for it. But if you're curious of what the actual cost is if you have the GoodRx app on your phone, and I have it on mine, is at night, and I know it sounds nerdy, but I found it interesting, is I'll plug in the drugs that the commercial just came up for, and so far the highest cost one was $24,000 a month. That people just don't realize. Someone has to pay for the commercials, but there's the first $1 million drug hit the market this year. I mean, the prescription side is crazy on the cost, but I just find it interesting of what those prescriptions are, and then people will say to me, well, why is healthcare so expensive? Let me think. That's one of the reasons, amongst others. But it's educating, asking questions. You know, like Tyler mentioned about going to the emergency room. It would be, I'm hard pressed to go to the emergency room for anything with all the options we have out there, especially years ago, you would have 2 options. You went to the doctor Monday to Friday, or you went to the emergency room when they weren't open. Now you have minute clinics, you have Kroger's, you have all these clinics, you have virtual care. They give you access 24/7. But you pay for that access and you make that decision. But just stop and think. Now, if you're having a major event, please don't stop and go, what did Michelle say? Where am I supposed to go? Go to the emergency room if, like, you're really bad. But for the basic stuff, urgent care can do a lot. They can do x-rays, blood work, stitches. And it's much less expensive and a much quicker way to seek care. You can even do, say if you have a really bad rash, you can do that through virtual care, and you can FaceTime, or their version of FaceTime, of actually showing it to them or sending them a picture. So there's lots of options out there. It's just stopping and thinking for a second of what's the best way to access my care. Then on the flip side of your care, so now you've had care, now what do? Well, you're going to get a bill in the mail. And I'm not going to be standing there when you open up your mail. But always pay attention. I'm telling you, in the 15 years I've been in Georgia, there's yet to be a year where I don't get an incorrect invoice. And I could just pay them when they come in. But again, that's my money, and if I can save. And I've had some pretty big ones. I've had ones that were like $28 off. But it's money that I shouldn't be paying someone else because they're not going to send it back to me if they find the mistake. So looking on the carrier website, up through the end of the year, you'll have United, and then you'll have Humana, so have the app on your phone. And if you go to your claims, it'll say patient responsibility. And it should match to the penny to what your invoice is. If it's wrong, contact us and we'll do the research. Or you can contact the vendor and make sure it's correct. But studies show that 4 in 10 invoices are incorrect. And it's not because they have a bad billing department. It's all electronic code. So if they type in the wrong 4-digit code, it generates the incorrect bill. Years ago, we had a gentleman that was charged for having a baby instead of his wife. And you wouldn't realize it took 6 months to get those bills fixed because he didn't have maternity baby delivery coverage because he couldn't have a baby. And so it's crazy, and it's not that they're irresponsible. It's just all about coding. The other thing that hospitals like to do nowadays is charge you up front. They call and hear what your deductible is, and they say, okay, you have to pay us before we'll even touch you. Be careful when you get all your bills and be organized, because it all has to do with who bills first. So that you could have paid the doctor for an amount, but then the anesthesiologist bill gets there first, and he applied the deductible. So just keep a spreadsheet. United and Humana will let you download Excel sheets. But if you're not sure and you feel you're paying too much, reach out to us. We're happy to review claims. If something looks wrong, stop and ask a question, because we've been able to save, we've had many instances where we've saved hundreds, thousands of dollars for people. We had one, not here, but another client. Her son couldn't metabolize his medication for his bipolar medication. So they had to send for a special test to prove it because they were pretty sure that's what was happening. And the bill for that was $5,000 for that special blood test. And it got kicked by another carrier to out of network. Well, having gone through some genetic testing with my kids, I knew that some labs will help you. So, and this is just from experience, I try to bring my own personal experiences in to help people. So when we got it denied, our appeal, and she still owed $5,000, told Stone, do me a favor, call the lab she went to. So we took the carrier out of it and asked them what they do for people to help them if their insurance won't pay for it. And they said, yeah, we do have a program, it would be $350. So it's just, if you call us and we know a trick and a way, and I can't promise anything, but I will uncover every rock and stone to try and save you money. Because at the end of the day, this is a ministry, and I know that everyone's on limited budgets. So it's just taking that time to look at it, understand it, asking the questions on the beginning, and then paying attention at the end, so that you're getting the best health care, but you're not paying for things that you shouldn't be paying for, or you're at least getting the best deal that you can for the care that you need. Again, we will follow up with the enrollment instructions. We're going to leave questions here at the end. Go 365 is a great program. You can feel confident on the plans that we're offering. They're the same exact plans that not only are my employees on at our company, but I'm on. I'm on a simplicity plan, so I understand exactly how it works. So if you need specific examples or have questions, if you want to look at the doctor's list, you can go online, or you can email us and we can research it. Because I have found in the past sometimes if you have like a large practice and there's multiple doctors and it can get confusing looking, if you send us a list of your doctors, we're more than happy to do that research for you. Same with if you have any transition of care questions, because that's the other thing. Sometimes you could be in the midst of having care, how does that work? And we can help you through that piece of letting the insurance company know or your providers know what your new insurance is. Because our goal is to have the enrollment wrapped up by the beginning of December, so that gives us a whole month to get you ID cards, because I know for the holidays a lot of you travel. But in the event that once the group number and the ID cards are issued, even if you're not home to get your mail, you can download the Humana app and you'll have a copy of your card on your phone. So you don't have to have a paper copy to have care. Once we issue the group number, and you all, I'm assuming, have access to email when you travel, we'll make sure that you have that information. If by chance you run into an issue, Snow and I check our emails all the time, but even over the holidays, to make sure that everyone's covered, because at the end of the year, you have Christmas this year is like on a Wednesday, so a lot of companies are closed that Wednesday, Thursday, Friday, and then you have New Year's that following week. My only suggestion, whenever you change insurance, try not to schedule a bunch of big stuff on January 2nd, because sometimes it gets complicated if you don't have all your papers in place. But the carriers can call in to confirm coverage as of the 1st, and you can provide information through your download of your ID cards. One thing is to say if you're on a prescription that you take every month, it could be for a series of different conditions, is fill that at the end of mid-December so that it'll get you through the holidays. Say if something happens and your card got lost in the mail, you never know. But just fill your prescriptions on United so that you have that going into the new year, and you're not standing at the pharmacy on January 1st trying to get something refilled on a new plan. I mean, it should work, but I always like to have a plan B, and prescriptions are usually the ones that I see people in panic mode calling, texting, and emailing me on New Year's Day. That I do try to take a couple days off, but I'm more than willing and will help anyone on any day that you need that. But any questions? Any issues you've run in with dental and vision? This was our first year with Humana. I think it was a positive move from everything that I got back. The big one on dental and vision, go in network, especially on dental. When you call and you say, if you're going to the dentist for the first time, and you say, do you take Humana? And if their response is, I'll file the claim for you, that doesn't mean they're in network. So then what happens when they're not in network, Humana will still pay, but you potentially can get a balanced bill and pay more. So you always want to make sure, just like we do on medical, we all work very hard to stay in network, even more so on dental and vision. Your dollar is going to go the farthest on both vision and dental if you go in network. You can go on a network and you still have coverage, it just won't pay as much. And I really like the Humana Dental plan that's unique in the industry, that say if you max out what your benefit is, say if you had a couple crowns and all your money's used up, they'll still continue to pay 30% of the major services, and they're one of the only carriers that does that. So actually your benefit is a $1,000 benefit for major. On top of that is your cleanings, and on top of that, they'll pay additional 30% if you need it. So it's a really great benefit, and they're the only dental carrier that does that. All right, 10:53, questions? Yes, ma'am. The biggest things what carriers look at is money in and money out. It's simple math. So if, for example, you choose to go to the emergency room to get this 2 stitches on your hand versus urgent care, I'll just give you an example. An average emergency room visit's $2,100. Urgent care is $400. So when looking at care, and why I encourage you to be a good advocate, is anything we do to save the carrier that you save money helps claims, so that the money in, money out has a better ratio. If you're an overspender and you just don't care and you think, oh, it's the insurance company's money, it does catch up with you at some point. Wellness is a huge piece of it, but being a wise consumer to save your own self money ends up saving the carrier money, which is how they in turn bring your renewal to you next year. Now, if you have a big event in life, there's nothing you can do to control that. But all the little things you do to save money add up when you have over 100 people. If you all saved $1,000 a year, do the math. I mean, that's $100,000 in claims. That adds up. So it's just being a better consumer and making sure you're not, especially on the prescription side. Because think about it, if you're taking a $5,000 drug and there's a $500 equivalent, the savings that can be had there. Now, there are some new biotech drugs that you have to take because of the condition you might have. But there is a ton of money to be saved on the pharmacy side just by asking questions. And again, it's just like the example I gave with my mother. She knew no better. Because most of the time when you go into a doctor, they're prescribing what is the latest and greatest because that's what they're educated on. And they don't know the differences, or if a generic, what the difference is between the newer ones. And the pharmacist is the one that knows. And so that's who I ask, is what is a less, to save me money, is there an option that I can do that's virtually the same? But it's a trickle effect for future renewals to save money in total. So if everyone's, just looking, asking those questions, it's a positive down the road of the overall money in, money out of how insurance companies look at it, because that's what it boils down to.
It's a really good question, and I'm gonna, some of the stuff can be really intimidating, just because the terms are not always things familiar that we work with. But as a dad of a large family with a couple of special needs kids in it, and I had 2 surgeries outside of those special needs kids this last year, how you approach this is really, really critical. So I want to give you some real practical examples in Gainesville, since we all kind of live here, of how you can do that. There's a popular dentist here that my family actually loves, and they're out of network. And and they're popular amongst our body as well. So I'm not depreciating them. They really do a great job. And with a couple of kids that really struggle with dental care, with Gage and Felicia, it's really hard for us to move. We had 2 material things that there was a cap and there was a crown that needed to be done in the family. And I began to look at the costs of that. And so I got them to quote it in advance. They are not in network. This is BGW. I got them to quote it in advance. And I went and got 2 quotes from in-network providers. And there was about a 40% difference. And when I say 40%, I'm talking $600–700 for those services. So I ended up going back to BGW, and they said, well, we can't really match that. Ultimately, they called back to my wife and said, we will match it, which was good because we wanted to go there. And they did match it, except that the billing was all wrong. And it's taken us probably 2 or 3 hours to get it sorted out. But if you don't go into that level of detail, you're basically saying that much money is okay to spend to not do it. The other piece that I will share with you guys is there's some practical decisions. I'm going to get to the individual level, then I'm going to talk about it from an adventurous perspective. At an individual level, I've learned some things this year as well. We had long gone to one of the local immediate care facilities when we really had something going or something on the weekend. And the copay's a little higher, but I ended up starting going to the Kroger and using the app. And then I also found out that the Longstreet immediate care actually bills not at the immediate care rate, it bills at the primary care rate. So you can go in there, pay a lot lower fee. They're open till 9 o'clock. I was playing wiffle ball, some of you in flip-flops, end up tearing my foot up. I go out there, it was $40 for X-ray, for everything. It was a big savings to us. Kelson had 2 surgeries, including having to use those gnarly anesthesiologists at the emergency room here at North Georgia. And a number of us have had issues with that in the hundreds to thousands of dollars. And the other thing I would encourage you to do is you got something coming, start calling your providers, making sure that the individuals behind a surgery or an event are in network. And if they're not, begin negotiating out of the gate. And you can negotiate payment terms, you can negotiate rates, all that's up for grabs. If you don't do it, they're going to kick you in the kneecap, and they're going to send you a big fat bill on the backside of it. And I'm not talking hundreds of dollars, I'm talking thousands of dollars. Now, to the adventures piece of this Humana policy has something unique. You know, we've been playing this game of let's see where we land, and we'll see who's available to us, and we kind of slide right under the tag of trying to get the best option for us. Humana's actually approached us with a program to say, we're going to tell you what your rates are going to be next year based on your utilization. So, guys, we've got when stuff happens, we need to use our insurance. But we need to be wise in it, because the reality is we can actually as a body, control our rates for next year if we're good stewards. And we have a running advantage because most of you people are young. And that is good. But if we use Longstreet instead of going to the ER, the amount that is paid out by Humana versus going to the lower cost that might be able to do the 2 stitches for $40 is going to end up dictating what our rates are next year. So we do have some influence, you know, and it all adds up when we do it. So just encourage. And if you've got questions, and I hate to say it, I've become a bit of a consumer expert, not an industry expert, in buying this stuff because it's just so stinking expensive. So.
Good speech. Hopefully I've helped you through the years with all my tips.
We helped to understand. We had some issues with, we're not the only one having issues with North Georgia Medical Center. It's in the newspaper. And their own employees have Blue Cross and Blue Shield, and
they're out of network now.
Out of network. So if you work at North Georgia Medical,
and that's the other thing.
Insurance at the hospital you work
Yeah. And I'll give you a good example. So my daughter and I mentioned before that we went through genetic testing. So I tried back in 2012. We have 5 different specialists, and it was just a pain to go to 5 different doctors here. So her and I fly to the Cleveland Clinic once a year for all our tests because they specialize in what we have. It's okay for you, and I bring it up, to drive a half an hour to an in-network hospital if it saves you money. I know it's convenient, but if Northside or Emory and they're in network and it's going to save you money and it's a outpatient procedure, it might be worth a drive you know that you're not going to be paying out because you pay for convenience. So if it's an emergency, you have no control over that. But I made the decision that for my family, I was receiving better care by someone who specialized in what we do versus I would go to doctors here and they would Google it because it's a rare condition. And that wasn't really they'd bring a paper in, is this what you have? Yeah, thank you. That's not what I'm looking for. I can do that myself and stay home. So that's what we do, and it's a center of excellence, and it's covered by Humana, paid for it when we went up there in July. So I'm not saying, do that all the time. My point is you've got to take care of yourself, but on some of the little stuff, you can do it not always at that hospital if it's not the best deal for you. And sadly, anesthesiologists are ones that are doing the out-of-network thing the most, but now you're seeing others doing it. and they're just trying to make more money, and I get it. They don't want to take a discounted rate, but it makes you as a consumer definitely have to ask questions. Same with an MRI. It's going to be way more expensive at the hospital than one of these freestanding clinics. And believe it or not, the freestanding MRI clinics have more state-of-the-art equipment than some of the hospitals. So you're not sacrificing your care, you're just being a smarter consumer. Any other questions? And if in 6 months you need a referral to save money and try and do research, and I've had people email me over the years from here, I'm more than happy to do so, because that's really what I take enjoyment out of, saving people money. I know it sounds weird, but it's we work hard for our money, and I hate to see any money just wasted on things that there was a better way to spend the dollar. All right, it's 11:03. I'm done. I can't talk anymore. But I'm here all day, and then back at 2, I think it's 2 o'clock, right? I'm doing the the Benefits 101 class. If you really want to be like excited and learn all the terms about insurance, it's 18 pages long. It's very exciting. I'll be here at 2. I know a lot of you come off your parents' plan, and poof, you're supposed to be an expert. It's confusing, so my goal is to try and simplify it even more at the 2 o'clock session. But thank you so much for your time. I really appreciate it. Thank you.